Hey everyone, Dr. Gary here, double board certified facial plastic surgeon. This talk will be about Lil Kim and her plastic surgeries of the face. So I'll go through year by year and talk about the different transformations and the types of procedures that I think she may have had done. And in this video, we will be doing the letters game. This is something new that we're introducing. We wanted to thank you guys for your support, and we know that people like games and they like prizes, so we're giving away $50 to a random subscriber for each new video that features this letters game. Something new that we're trying. There will be random points throughout the video where you'll see these letters, 4 different letters throughout the video. They'll appear, and you have to put those 4 letters together as a code that they form, just 4 letters, and you DM me that code on Instagram at Dr. Gary NYC. That's Dr. Gary, my name, NYC, and we'll announce the selected winner in the next video that features this letter game. It's not in every one of our videos, but in some of these more reaction and fun videos, educational ones, you'll see it. So good luck, and thanks again for all the support. And make sure you watch till the end of this Lil Kim video, because I'll be talking about reasons as to why she may have had all this work done. So we start in 1997 when Lil Kim was 23 years old and she looked amazing, right? I mean, everyone thought, at least everyone who I knew, thought that she was very attractive. And in 1998, we have her here at age 24. 1999, the MTV Music Awards was like iconic with the dress that she had. She's 25 years old. She has wonderful features, heart-shaped face, beautiful brows, eyelid position, all looking very good. Good nasal definition, especially. It respects her ethnic features. It looks very good. Great lip proportions. She has upper tooth show that you can see here, and fairly short philtrum, and has excellent jawline definition, and a really amazing cervical mental angle, right? So really nice definition here. 2000, she's now 26. Very good skin texture and complexion. And then when you look on the profile view, just an amazing view. Really acute cervical mental angle. High placed hyoid bone, which is like a genetic thing where your hyoid bone rests, and that's going to dictate that angle. And just looks stunning, right? 2001. Age 27, really nice hairline position. You know, just overall proportions are there. Nice cheek definition. She looks like she's had a rhinoplasty already done at this point, based on the more narrow bridge and tip that I'm seeing. So somewhere probably between 25 and 27, maybe had her first rhinoplasty. Age 28, it looks like she's maintained her appearance quite nicely. Don't see too many major changes. Age 29 in 2003, again, looks great. Likely at this point has started to introduce some neuromodulation with, say, Botox and probably some fillers. Age 30 in 2004, it's looking like she's maybe increasing the frequency of her fillers. The lips are bigger, the cheeks seem a little bit more full. And then at age 31, I think continued facial fillers starting to kind of increase the fullness overall of her face. Age 32 in 2006, I think that there is a combination here of facial fillers and potentially some weight change that's contributing to the fuller look of her face. And at this point, we can clearly see that there has been more nasal surgery because of that lateral wall collapse, and it's really starting to get more pinched in. So clearly she's had additional nasal surgeries since that first one when she was about 26. Now, age 33, to me, it looks like a lot of what you're seeing here is a result of some weight gain, right? Weight fluctuates as we age, and the face can change quite a bit when there are periods of weight gain or weight loss. I had my video out on Kelly Osbourne. A lot of people, started to jump to conclusions about, V-line surgery and jaw surgery, all this stuff, and but weight loss can lead to a lot of facial changes even without surgery. So something that I think a lot of people don't realize. It's important to keep that in mind. And yeah, what I'm seeing here is in 2007, her jawline is just less defined. Doesn't mean that she's had necessarily more surgery there. I think weight here has a big role to play. In 2008, at age 34, her cheeks are starting to look, to me, less natural. There's an overemphasis on the medial cheek volume in this area as opposed to the lateral aspect, which is sort of where you usually want to put filler and re-emphasize volume. And I think this is being done with probably filler, maybe some implants, but there's just too much occurring in the medial cheek area that's looking less natural. At this point, this is just a reminder to everyone to please subscribe to the channel, like and comment, and turn on the notifications so that you guys can find out when we do more of these awesome videos. Thank you so much. So moving on, 2009, age 35. Looks like she's lost weight. And so you're seeing the face thin out, and despite the fillers and maybe some implants, there's still a bit more of a thinness to it. And it looks like she may have had additional rhinoplasty surgery, because now I'm not seeing that lateral wall collapse as much. So I think she's had some graft work there to fill in those defects. Probably at this point, we're talking about at least 3 rhinoplasty surgeries by age 35. Age 36, 2010. Of course, there is some natural aging that's occurring, so certain features are changing because of that. Age 37, 2011. To me, the upper face still looks very natural. The mid face looks overfilled, and the philtrum, that area underneath the nose, between the bottom of the nose and the top of the Cupid's bow, it looks like it's lengthening, right? It's getting longer. So a lot of people come to me for lip lift surgery, and that's one of the reasons why, as we age, that distance elongates. 2012, age 38. This is where it changes, right? Major change alert. Something has really changed here, and I think Lil Kim has had a loss of that natural V-shaped, heart-shaped face. The bottom part of the face is just starting to look a little heavier. She's had a loss of jawline definition. And I wonder if maybe at this point or around this time, she's had maybe some fat transfer to the face. The fat that's transferred is sort of irreversible. It's not reversible. And so it's different from HA filler, which you can dissolve. Fat, however, just kind of stays there. And it can sometimes appear a little lumpy bumpy in places if it's not injected deep enough. And it can give some irregularities to the face from one side to the other, because about 50% of fat that's transferred will resorb and not be there over time. So I think she may have had a facial fat transfer procedure by around this time. Age 39, again, I'm seeing a little bit just more added just weight. The neck even looks a little fuller. I wonder if, again, there's some maybe weight change fluctuations. Age 40 in 2014, continued loss of that sort of V shape that she had in her youth and that heart shape. And that occurs with all aging, but the jawline is starting to kind of have additional definition. So I wonder if maybe around this time she's maybe had a lift, a little facelift, neck lift. Maybe she's even had some additional, maybe some implants in the mandible, along the mandible, to provide a little bit more of that boxy look. I don't know if that's what she was going for. So I think that there's some role for implants in explaining the changes that I see here. The chin also seems a bit more prominent, so potentially she's got an implant now running along the mandible that's accounting for some of that change. Age 41, again, the face just looking very full. I think she's starting to experience some filler fatigue, which is when you just over-injected with filler, be it fat or HA filler, and it just makes the face just bigger and bigger and bigger, and it's hard to kind of eventually shrink it down. And again, age 42, there's just this unnatural facial fullness. She doesn't look like herself. She's starting to look like somebody else. Age 43, the philtrum, you can see that it's longer. The upper teeth are no longer visible on repose. Repose is when you just open your mouth without any facial expressions. And I do that before a lip lift to judge how much tooth show there is, and usually that improves after the lip lift. In her case, with Lil Kim, you can just see with the aging process, it's starting to kind of act as a curtain covering up those upper teeth. The face still looks very full, and the upper third, however, of her face, to me, looks quite maintained. So whether it's through surgery or neuromodulation with Botox, but she's overall, I think, maintained the upper face pretty well. Age 44 in 2018, she's definitely had a facelift by now. I think it occurred years prior, but just to point out here, this would not have been her natural jawline based on what I was seeing earlier. So I think she's had a lift, and I think it may have been over pulled on the right hand side, because I'm just seeing that everything on that side just seems pulled up higher. Now, could this be part of her natural facial asymmetry? It's possible. When I look back at her pictures in youth, there's a bit more symmetry than what I'm seeing here. So I think may have been a result of a surgical procedure. She may have had a brow lift that got a bit exaggerated, or a cantopexy or cantoplasty on the right side that was a bit over exaggerated. I think her nose has continued to go through additional surgeries, especially alarplasties, which is where the base of the nose is made smaller with either a sill removal, sill excision here, or a wedge excision, or both. But you can see, look at the opening of her nostrils, that aperture has decreased significantly, and that's the result of alarplasty surgeries. And the upper lip to me looks quite filled, maybe with filler, maybe there's an implant there. And again, the face to me just looks a bit boxy and not anywhere resembling her original face. Age 45 in 2019, I think her overall skin texture has declined. There's a lot of makeup on, but you can see, especially on the nose, that there is some issue there with the skin quality. And to me, that signals that there's some potential skin damage, and that could be from all the rhinoplasty surgeries that she's had. It could also be from potentially filler that was placed into the nose to try to cover up certain things, and maybe instead in place of additional surgeries. But the problem with filler in previously operated noses is that your risk of vascular occlusion, where the filler gets into a blood vessel and blocks it up, the risk goes up. And so maybe she experienced something like that. Age 46 in 2020. She looks like a different person, different ethnicity. From the eyes to the nose, she does not look like the Lil Kim that we all knew and loved. Just looks like a different person. We'll talk about why she may have undergone all these changes. Age 47, the brows to me are looking very unnatural, whether it's a tattoo or makeup. But it just looks very two-dimensional and over-exaggerated. The eyes to me look too sloped laterally. Again, the medial aspect of the cheek is too filled. There is absolutely no lid cheek transition. And of course, we don't love tear troughs, and there are procedures to try to improve on tear troughs. However, when there's absolutely nothing and it just looks like, you know, the eyes go into the cheek, there's just not a very natural look, and there's very little resemblance to the way she was originally. So the question is, why did Lil Kim go through all of these transformations? So I think Lil Kim may have had all of these procedures done for two main reasons based on research that I've done. In 2005, she gave an interview at age 31 where she talked about nasal injuries that she sustained from domestic abuse, which was really sad to me to hear, because you never want to hear that, you know, something like that, you know, could happen to someone, especially not someone of Lil Kim's stature. But it seems like she was the victim of domestic abuse, and that left her with injuries that she then had to go and get repaired.
While I was some people's role models and Lil Kim, and I mean, I had broken nose, black eyes, all that stuff.
So that, you know, probably affected her breathing, and so there's things beyond just the cosmetic aspect of it that I think gave her the need or the desire to go and get certain types of nasal surgeries done. And in addition to that, she has said, and we'll play the clip here,
I have low self-esteem, and I always have. Guys always cheated on me with women who are European looking. You know, the long hair type.
That many guys have cheated on her with European types. And so she wanted to change her look potentially to resemble that. So maybe that explains some of the boxiness of the lower face that she was going for, the changes in the eyes, the changes in the nose, really just trying to fully transform herself into someone that she's not. It's a little bit sad to see. It's what happened to her, and there are these reasons behind it. And you know, I just want this video to serve more as just a educational piece so that people can figure out, you know, why certain things, how certain things change, maybe why they change, but also just to think about sort of the bigger picture of plastic surgery and where it kind of fits into society and what its sort of purpose is. And I think when it's abused, I mean, there are times when I think people go too far on the surgical side, you know, as a surgeon myself, and I think on the patient side, sometimes people just go way overboard with with certain procedures. There's this potential for improvement, but then sometimes people go too far. So if you enjoyed this facial analysis video of Lil Kim, please check out my video on Michael Jackson's nasal surgeries. And so click on the card and I will see you there. Thank you.